Welcome, everyone. I'm Ian Delaney, acupuncturist and Chinese medicine practitioner at Nature Cures Clinic. And I'm here today to talk about seasonal allergies and how to get relief from them using acupuncture and other natural medicine. So, even though you suffer from seasonal allergies, don't lose hope. There is a light at the end of the tunnel, and I'm happy you're joining me today to find natural relief. If you have any questions during our time together, please feel free to post them, and I will do my best to respond quickly. Before we get into the benefits, let's take a look at what allergies are and how the body reacts to them. Approximately 5 million Americans suffer from seasonal allergies, also referred to as hay fever and allergic rhinitis. Oftentimes, allergy symptoms are confused with cold symptoms. So, what exactly is responsible for all the fuss? Well, different people react to different allergens. Trees, grass, pollen, as well as ragweed are the most common culprits of outdoor seasonal allergies. To identify exactly what affects you, a skin test is usually recommended. The most common symptoms include sneezing, itching, watery eyes, runny nose, and nasal congestion. These symptoms are similar to cold symptoms. However, muscle aches and pains, even nausea, typically accompanies colds, not so much allergies. And allergy seasons vary across the country, with pollen starting in the early spring, lasting through the summer. This is a tough time for a lot of people who struggle with seasonal allergies. Let's break down the common allergens by month according to the United States typical weather patterns. And obviously, this varies from state to state and from region to region. But in January, pollen is typically low. However, cranking up the heat indoors can kick up household dust. In February, depending on where you live, trees can cause allergy flare-ups this time of year. Common offenders include catalpa, elm, hickory, olive, pecan, sycamore, and walnut. In March, which marks the beginning of spring, tree pollen remains high on the list. Be sure to check out your pollen count regularly. In April, flowers are blooming, and so are allergies. In May, tree pollen should be winding down. However, grass pollen is emerging in certain parts of the country. In June, grass pollen will be in full bloom. Factors such as temperature, rainfall amount, and even the time of day will impact grass pollen levels. July and August, if you're allergic to molds and spores, you're out of luck, as July marks the start of fungus spores and seeds as August sees their peak. September through November, ragweed is most commonly the cause of fall allergies during these months. And in December, pollen count is typically tame. However, if you suffer from allergies during this month, it may be from microscopic mold spores that can harbor in Christmas tree branches. Allergies in the immune system. The immune system acts as a defender against microorganisms such as bacteria, viruses, and fungi, which can cause harm. The immune system works hard to destroy infectious microorganisms that enter and invade the body. The immune system is made up of a complex network of cells that attack and destroy unwanted pathogens. These cells consist of lymphocytes, which are a type of white blood cell that defends against invading microorganisms such as allergy-causing pollen and dust. The lymphatic system is made up of a network of lymphatic vessels that carry lymphocytes to and from different areas of the body. Various lymphocytes, or factories, are located throughout the body. For example, the adenoids, thymus, tonsils, and spleen are just a few places in the body which produce these specialized white blood cells. Allergens can enter the body in numerous ways. They can be inhaled, ingested, or enter in through the skin. Common allergic reactions, such as hay fever, trigger the antibody production called immunoglobulin E, or IgE for short. IgE antibodies react against specific pollens and other allergens. This is why someone may be allergic to one type of pollen but not another. When a person is exposed to an allergen, the body overreacts and starts producing a large quantity of IgE antibodies specific to the allergen. The excess IgE antibodies release chemicals causing symptoms in the nose, lungs, throat, or on the skin. The excess mucus production is used to help trap the allergy-causing invaders such as pollen for easy removal. Acupuncture has been used for centuries by every culture. Many studies link numerous health benefits to the placement of tiny needles along specific acupressure points. You can also add treating allergies to the list. Using acupuncture to treat allergies is often a quick response. Many find relief during the first visit. In fact, many receiving acupuncture treatments report significantly reducing or eliminating their dependency on allergy medications altogether. That's pretty amazing. And there are different types of acupuncture styles too. Some of these include traditional Chinese medicine, Dong-style acupuncture, Tan-style acupuncture, all three of which we practice here at Nature Cures Clinic. Among other popular forms of acupuncture are Japanese styles, Korean styles, and 5-element. There's actually a lot of evidence to support the use of acupuncture for the treatment of allergies. And over the years, I know there's been a lot of debate over the effectiveness of acupuncture. For centuries, people have benefited from acupuncture. Now there's evidence to support this. Numerous studies have demonstrated that acupuncture alleviates allergic rhinitis and regulates antibodies. Scientific evidence confirms that acupuncture successfully downregulates the IgE response, lessening symptoms. Studies from Stanford, MIT, Griffith, and Western Sydney universities concluded acupuncture effectively alleviates persistent allergic rhinitis. The University Medical Center in Berlin conducted a large control study examining the effectiveness of acupuncture for the treatment of seasonal allergic rhinitis. Results conclude that the group receiving acupuncture therapy reported greater relief from symptoms than the group that did not receive acupuncture therapy. A group review of numerous published trials point to evidence to support the claim that acupuncture is beneficial and cost-effective as an additional treatment for seasonal allergic rhinitis. So how acupuncture works. This is a very simple approach, and coming into our office, we often describe a little more detail to our patients. But acupuncture is based on traditional Chinese medicine, which works by maintaining a healthy flow of vital energy through channels or meridians of the body. And this vital energy we tend to call qi. A total of 71 meridians that serve all organs, muscles, nerves, and surfaces of the body. Acupressure points are located along the meridians where qi is accessible. Allergies tend to block the flow of energy through the meridians, causing symptoms of sneezing, itchy, watery eyes, etc. Though insertion of tiny needles into specific, through insertion of tiny needles into specific acupoints, energy is restored and symptoms are alleviated. Acupuncture works to remove blockages, eliminate excesses, remove deficiencies, and correct imbalances that occur in each of the meridians. Something you might not know is that acupuncture also prevents allergy symptoms. Because of this, ideally, you want to get acupuncture before your symptoms start. An acupuncturist will utilize various acupoints located on the face, hands, and feet to alleviate allergy symptoms. The points used for allergy relief include 6 symmetrical points that are stimulated simultaneously, 2 just outside the nostril, the bone indentations just below each eye, and the points located in the inner end of each eyebrow. In addition to the 6 points on the face, acupuncturists often incorporate a 7th point to address the root cause of seasonal allergy symptoms. This point is located on the left foot, which is used to release energy obstructions believed to cause excess phlegm. Your acupuncturist will take a health history from you and determine if there are any other conditions troubling you. Next, let's talk a little bit about stimulating acupuncture points without the use of needles. Acupuncture without needles is often called acupressure, and acupressure is a complementary treatment to acupuncture. The process utilizes the same pressure points but without the needles. Stimulating the points is not a substitute for acupuncture. However, they can help delay and lessen the onset and severity of the allergy symptoms between treatments. Acupressure, like acupuncture, can be used to treat stress and anxiety, migraines, allergies, nausea, vomiting, pain, and more. Acupuncture is a great technique to use between acupuncture visits, and it can be done by a massage therapist, or in some cases, you can do it yourself. You simply need to apply pressure to the points connected to the symptoms you are experiencing. Relieving allergy or sinus problems can be done with acupressure in about 6 minutes. Let's take a look at some techniques. There are two places on the face you want to apply pressure. One, using the index fingers of each hand, apply pressure to the outside corner of each nostril. This will help to open up the nasal passages. Using circular motions, we can stimulate the point and holding them for about 3 minutes in making either a static holding point of the outside corner of each nostril, or minor circular motions while applying pressure to that area can help to open up the nasal passages and the upper respiratory tract. Number two, using the index fingers and the thumbs of each hand, apply pressure to the inside edge of each eyebrow. This will help to relieve pressure above the eyes. You should spend about 3 minutes holding each point for a total of 6 minutes. Some additional acupressure points that you can use are on the hands and the feet. They're both mirrors of the same points, and you might be able to notice this as I describe where they are. So between the thumb and the index finger, there's a webbing area, and oftentimes people know of a point that's nicknamed the headache point. This point can actually be used to help with allergy relief as well. And massaging that whole area, the webbing, the muscle area between the thumb and the index finger, you can help to open up the flow of qi within the body and alleviate some of the allergies, as well as help with some headaches, particularly frontal headaches. The feet as well, between the big toe and the second toe, apply pressure to the webbing connecting the two toes, and just working your way up and down that area can help to really relieve allergies, irritability, a number of things. It's a great point for just getting things flowing again in the body. And those points you want to do for about 3 minutes. If you're short on time, you can do 1 to 2 minutes as well and get some benefit from that. Some other ways of stimulating a healing response in the body using acupuncture is something called auriculotherapy or ear acupuncture. And auriculotherapy is a procedure to stimulate the auricle of the external ear. By stimulating specific points, a number of health conditions can be alleviated. This process is based on the ancient practice of acupuncture. Some reported benefits of this particular style of ear acupuncture are that it's an easy process and it has no real side effects. It's also very useful in conjunction with forms such as other forms of acupuncture or naturopathic medicine. Treatment is often performed on the patient's dominant ear. For example, someone who is right-handed would start with the right ear. Subsequent treatment would be performed on the alternate ear. Points related to allergy symptoms. Some of these points are found, and it might be interesting to look in a mirror and see with your ears if any of this lines up for you, if you yourself suffer from seasonal allergies. But the very top of the rim of the ear is for allergy symptoms, and oftentimes if you have a bit of redness or swelling there, you can see that there's some allergic response going on. Another area is just below, a point below that area for the antihistamine response on that apex of the ear. And the tragus links to the nose. So any of those areas, if you notice redness, that can often indicate that there's some allergic or histamine response within the body. We have some additional tools as well that we're going to address today for allergy relief. Popular techniques for that include nasal irrigation, herbal supplements, essential oils, foods to avoid, and foods to get more of. So talking about nasal irrigation provides natural relief from cold and allergy symptoms, and it works best by rinsing out the nasal cavity with a saline solution. This helps to wash out mucus and trapped allergens. You can purchase a pre-filled container, a bulb syringe, or a neti pot. For a bulb syringe or neti pot, you will need to buy a saline solution powder or make your own. Starting with 1 to 2 cups of warm, sterile water, add 1/4 to a half a teaspoon of non-iodized salt and a pinch of baking soda. To get into position, lean forward over the sink at about 45-degree angles. Without pointing your head back, tilt your head so that one nostril is pointed down toward the sink. Place the spout or tip of the chosen container inside your nose, and with your mouth open, as you turn, release the liquid while breathing through your mouth. The solution will run through your nasal passages and drain outside of the other nostril. Gently blow your nose to clear out the remaining solution before repeating in the other nostril. Onto herbal supplements, there are a number of things that we can do that are helpful for relieving the allergy response, as well as boosting immunity. Some of the great ones to try are green tea, butterbur extract, licorice root, stinging nettles, and quercetin. Green tea is a natural histamine, and having 2 cups a day for about 2 weeks before the development of allergy symptoms to avoid congestion can be particularly helpful. Butterbur extract has been used for treating coughs, asthma, and hay fever, as well as headaches. Licorice root helps to boost natural steroid production in the body to help loosen mucus. Stinging nettles can be taken in capsule form or as a tea, and great news, this natural antihistamine doesn't make you drowsy. Quercetin is an anti-inflammatory, which helps boost immune function. Some essential oils that you can use, which we recommend largely if you're using essential oils to not take them internally unless otherwise directed by a naturopath or other medical practitioner provider, because they can be dangerous when done internally and especially undiluted. But these ones we tend to recommend applying to a diffuser, 1 to 2 drops of each, and they include peppermint, basil, and eucalyptus. And with peppermint oil, it acts as an expectorant to help discharge the phlegm and reduce inflammation. Basil oil is used to reduce the inflammatory response of allergens, detoxify the body of bacteria and viruses, all the while fighting pain and fatigue. And eucalyptus oil can be used to help open up the lungs and the sinuses. Some foods to avoid, especially during allergy season, but pretty much throughout most of the year, it's best to avoid the use of alcohol, caffeine, dairy products, chocolate, peanuts, sugar, artificial sweeteners, processed foods, melons, bananas, cucumbers, sunflower seeds, shellfish, bottled citrus juice, echinacea, chamomile, or wheat, and soy. And these foods can worsen the allergy symptoms and trigger allergic responses in your system. Remember, the goal of reducing allergy triggering foods is used to lighten the overall burden on your immune system. We have some foods as well to I encourage you to get more of, and these include raw local honey, hot and spicy foods, bone broth, probiotic-rich foods. Some of those things include different fermented foods, particularly yogurt is quite helpful. Pineapple, apple cider vinegar, fresh organic vegetables, grass-fed meats, free-range poultry, wild-caught fish. And these foods can help to relieve your symptoms while strengthening your immune system. And some teas that we recommend as well are a nettle peppermint tea and a honey ginger tea. And these can both be done, either you can buy them pre-made or better to make them at home with fresh ingredients. To do the honey ginger tea, we recommend just taking a couple chunks of fresh ginger that were sliced, 2 slices of fresh lemon, a tablespoon of raw local honey, 1 tablespoon organic raw apple cider vinegar, 1 quart filtered water. And basically what you do is you take that water and you just get it simmering and add in the fresh ginger and have it simmer for about 10 minutes. And then turning off the heat, we want you to add the lemon, those 2 slices of fresh lemon, some raw local honey, the raw apple cider vinegar, and then you can drink that either warm or cold. Typically warm is a little more helpful for the body, as the heat itself can help to open up the nasal passages. So to recap, which I know it's a lot of information, but allergies are no joke, and finding natural remedies to keep you feeling your best is so useful and often more effective than choosing over-the-counter remedies. And we all know sometimes they work and sometimes they don't. So don't forget the worst part, the medicines with ingredients we can't pronounce also have negative side effects. Acupuncture is one of the most effective remedies for preventing and treating seasonal allergies. Other natural remedies we discussed include nasal irrigation, herbal supplements, essential oils, foods to avoid, foods to get more of, and some teas. And again, if you have any questions, please feel free to reach us at our clinic, giving us a call or emailing us. We also We do encourage people to come in and get a consultation with us, see if we're a right fit. But I hope you all have a wonderful allergy-free winter and spring. Enjoy your new year.